Hello all. In today's video, I'm going to discuss about diet for peptic ulcer. The mucosal lining of the stomach and the duodenum protects the tissues from corrosive gastric acid and enzymatic secretions. If the mucosa is weakened or disturbed and cannot protect against acidic gastric contents, the tissue is damaged and this results in peptic ulcer. Peptic ulcer is a lesion of the mucosal lining of the upper gastrointestinal tract. The lesion can occur in the lower esophagus, the stomach, or the first portion of the duodenum, that is the duodenal bulb. Ulcers are common in the duodenal bulb because the gastric contents emptying there are the most concentrated. Peptic ulcer is a chronic disease with activation and remission periods, and its pathogenesis is characterized by the imbalance between the factors that damages the mucosa, chloride acid, pepsin, and ulcerogenic drugs, and those that protect them, that is the mucosal barrier, prostaglandins, and mucosal secretions. A peptic ulcer is a crater-like lesion in the wall of the stomach or duodenum that results from continuous erosion of the tissue through the mucosal layers down to the muscular layers. Clinical symptoms. General symptoms of peptic ulcer disease include increased gastric muscle tone and painful contractions when the stomach is empty. With duodenal ulcers, the amount and concentration of hydrochloric acid secretions are increased, whereas with gastric ulcers, the secretion may be normal. Some patients will have increased pain following a meal, while others experience relief from the presence of food in the gastrointestinal tract. Peptic ulcer normally involves two major regions, gastric and duodenum. Uncomplicated peptic ulcers in either region may present with signs similar to those associated with dyspepsia or gastritis. Abdominal pain or discomfort is characteristics of both gastric and duodenal ulcers, although anorexia, weight loss, nausea and vomiting, and heartburn may occur slightly more often in persons with gastric ulcers. Low plasma protein levels, anemia, and weight loss, they reveal nutrition deficiencies. In some patients, peptic ulcers are often asymptomatic. Etiology. The two most common causes of peptic ulcer disease are Helicobacter pylori infection and a long-term use of non-steroidal anti-inflammatory drug. Helicobacter pylori infection may be responsible for up to 95% of duodenal ulcers and 85% of gastric ulcers worldwide. The gram-negative spirochete bacteria disrupt the mucosal protective barrier, making it more vulnerable to acid damage and inciting an inflammatory response. The bacteria also reduces somatostatin production, leading to increased gastric secretion and action. Non-steroidal anti-inflammatory drugs are widely used medications. These drugs include ibuprofen and aspirin. Prolonged or excessive use of non-steroidal anti-inflammatory drugs irritates the gastric mucosa, decreases the mucosal integrity, and may result in erosion, ulceration, and bleeding. Other risk factors include increasing age. With increasing age, the gastric ulcers typically occur in patients over 40 years old, and the incidence of duodenal ulcer peaks at around age 60. Next is family history. More than 25 of ulcer patients have a family history of ulcers compared with 5% of non-ulcer patients. In addition, weak associations have been observed between duodenal ulcers, blood type O, and patients whose saliva and gastric secretions do not contain ABO antigens. Major surgery or severe illness. Prophylaxis for gastritis and ulcer may be administered in hospitalized patients, especially those on ventilation or those undergoing major surgery. Tobacco use. Nicotine increases the secretion and reduces mucosal blood flow, the stomach and intestine, and duodenum. Smoking is known to delay healing of gastric ulcers, but its role in the pathogenesis of ulcer and alcohol use. Alcohol can cause gastritis by stimulating acid secretion and damaging the mucosal barrier. No evidence for a role in ulcer formation has been found, but alcohol may delay healing of gastric ulcers. Faulty food habits. Large irregular meals, consuming meals irregularly, taking long breaks in between meals, skipping breakfast and having a large meal during afternoon can trigger peptic ulcer. Nutritional interventions. In the past, a highly restrictive and bland diet was used for the care of patients with peptic ulcer. A bland diet has long since proved to be ineffective and lacking in adequate nutrition support for the healing process. Such a restricted diet is unnecessary today because more effective medication regimens are available to control acid secretions and to assist with healing. Thus, current dietary therapy is based on a liberal, personalized approach that is guided by individual responses to food in an effort to maintain or improve nutritional status. Diet therapy has played a key role in the prevention and treatment of peptic ulcer, with main purpose of recovering and protecting the gastrointestinal lining, improving digestion, relieving pain, and contributing to satisfactory nutritional status. Calories distribution for patients with peptic ulcer should be normal, with values ranging from 50 to 60% of carbohydrates, 10 to 15% of proteins, and 25 to 30% of lipids, with total energy value sufficient to maintain or recover the nutritional status. A diet rich in fiber for individuals with peptic ulcer is advisable because fiber acts as buffers, reducing concentration of bile acids in stomach and the intestinal transit time, resulting in less abdominal bloating, thus decreasing discomfort and pain in the gastrointestinal tract. In the early 20th century, Sippy proposed a diet based on milk and milk cream combined with antacids for the treatment of gastrointestinal ulcer based on the principle that milk could provide gastric alkalization and relieve pain. Today, milk is not recommended due to the buffering effect and the significant gastric acid secretion effect of milk. Next is probiotic. One of the measures that may contribute to reduce the infection rate by Helicobacter pylori is dietary modulation with addition of probiotics. Probiotic organisms do not appear to eradicate H. pylori but can reduce the bacterial load and infection. Thus, an intake of 10 to the power of 9, 10 to the power of 11 CFU per day of lactic acid bacteria is recommended. Coffee raises gastric acid secretion, resulting in mucosal irritations. The same goes for soft drinks, which besides increasing acid production are gaseous and cause gastric distension and is dyspepsia related. Smoking diminishes secretion of the mucus and bicarbonate, raising the duodenal and gastric flow and increasing the risk of ulcer formation. A hearty intake of dietary antioxidants and avoidance of foods supplements known to increase oxidative stress, that is, trans fats, supplementation with iron or copper, that is, excessive supplementation with iron or copper, helps to restore gastrointestinal well being. Avoid stimulating excess gastric acid secretion, which irritates the gastric mucosa. Only the following few food related habits are thought to affect acid secretion. First one is food quantity. To avoid stomach distension, do not eat large quantities at meals. Avoid eating immediately before going to bed because food intake stimulates acid output. Irritants. Individual tolerance is the rule, but some food seasonings such as hot chili peppers, black pepper, and chili powder may irritate an already weakened mucosal layer. Caffeine, chocolate, and alcohol may increase acid secretions or prevent healing in some patients. patients will need to independently determine which foods are tolerated and which foods worsen symptoms. Smoking cessation is best because smoking provokes gastrointestinal mucosal injury and hinders ulcer healing. It also affects gastric acid secretion and hinders the effectiveness of drug therapy. Consumption of large amount of alcohol for any source may cause at least superficial mucosal damage and may worsen existing disease or interfere with treatment of the peptic ulcer. The recommended daily diet for peptic ulcer is given below. So this is the daily energy need, that is 20 to 25 kilocalories per kg body weight, is sufficient to maintain or recover the nutritional status. Whereas if the patient is malnourished and if there is weight loss, 25 to 30 kilocalories per kg can be prescribed. So we have acute phase and recovery phase, and the nutrient requirement they varies for both the phases. Carbohydrate is 50 to 60 percentage. Then protein is 1.2 in acute phase, whereas it is 1.5 grams per kg of body weight. Lipid is same, it is 25 to 30. Zinc is essential for wound healing. It is 11 during acute phase, whereas it is 40 milligrams during recovery phase. Similarly, vitamin A requirement is 900 microgram, whereas during recovery phase it is 3000. Vitamin C, 75 is needed during acute phase, whereas 500 milligram is needed during recovery phase. B12, for both the phases, it is 2.4 micrograms. Folic acid, 400 for both the phases. Iron is 45. Fiber is 20 to 30 grams. Probiotic intake should be 10 to the power of 9 to 10 to the power of 11. CFU, lactic acid, bacteria. So these are the foods that are allowed. And the next column, the foods that should be consumed with caution, and foods that must be avoided. So dairy products are allowed, and milk, low-fat cheese, yogurt, fermented milk. Fatty cheeses, they should be used with caution. Next, coming to oil seeds. Flax seeds and walnuts can be consumed. In case of oils, vegetable oils and olive oils can be consumed, whereas fried foods, deep fried food should be prohibited. Fruits, papaya, melon, banana can be consumed. Orange, pineapple, passion fruit, this should be consumed with caution. Lemon should be prohibited during the acute phase. Vegetables, leafy, dark green vegetables, carrot, beet, spinach, radish can be consumed. Broccoli, cauliflower, cabbage, cucumber, onion, and red pepper, they should be consumed with caution. And spicy peppers like black pepper, chilies should be prohibited. Legumes, bean soup, lentils, chickpeas, soya beans can be consumed. Beans should be taken in caution. Coming to meats, lean meat, they can be consumed, whereas fatty meats, they should be taken in taken with caution. Sweets, concentrated sweets, they should be taken with caution, whereas chocolate should be avoided. Natural juices can be taken. Citrus and acidic fruit juices should be taken with caution. Coffee, black tea, fizzy drinks should be avoided. Coming to other foods, seasonings, spices, and condiments like ketchup, mayonnaise, mustard sauce, all these should be consumed with caution. Conclusion, eating a well balanced and healthy diet helps with tissue healing and maintenance. Good dietary practices with adequate nutrient, fruit, and vegetable and fiber intake may decrease the risk of complications from H. pylori infection. Malnutrition originating from either micronutrient deficiencies or generalized protein calorie malnutrition affects rapidly the dividing cells, such as those of the gastrointestinal tract, and deficiencies may compromise the gastrointestinal wound healing. Overall, a high quality diet and avoiding nutrient deficiencies may offer protection from peptic ulcer disease and may play a role in healing. Thanks for watching.